Anushka Rakhe, and I welcome you all on behalf of the Mental Health Unit of Rotaract Club of Caduceus. Um, so today we'll be talking about a very important topic that it comes to our mind quite often, drug therapy or counseling, which is the right choice. And today we have with us a very special guest to enlighten us on this topic, Dr. Charan Teja Koganti. He's a renowned neuropsychiatrist from Hyderabad. He has been working as a consultant with the KIMS Hospital, Kondapur, and as an assistant professor at VRKMC, mentoring many junior doctors. His area of expertise include mental health issues such as anxiety, depression, stress, sleep disturbances, addiction, sexual disorders, behavioral disorders, and other psychological difficulties such as interpersonal relationships and stress management. He's a part of multiple research projects about neurological and psychological brain health and has published many research papers in reputed journals and medical conferences. He's actively involved with international schools for sex education. He is proactively teaching stress management strategies to many multinational corporations. We welcome you, sir. And we also have with us on board some wonderful students from Terna Medical College. So we have Mr. Atharva Dikshit, Ms. Nilofer Vora, and Ms. Amari Joshi with us. So I welcome you all on board, guys.
Good evening, sir.
Good evening.
Hello, sir.
Good
Hello.
evening, sir.
Hello.
Okay, so today's talk show will be going on in a pattern where I would be asking some common doubts that come to our mind, and our student panelists would be answering with their own experiences, and they'll be sharing their side of the story. And then we'll be getting a professional opinion from Dr. Charan Teja Koganti. So should we get started?
Yes, and you can address me as Dr. Charan.
Okay.
There's a lot of effort for the entire name.
Okay, sir. So the first question, how efficient is counseling compared to medications in depression?
So as most of you know, whenever you feel low, you'll always prefer talking to one of your friends. So there's been times when most of us have been captivated by such low thoughts and we really need someone to talk to. It's the same with depression. Okay, if I am facing something and I go to my friends, they can be good listeners, but at times their opinions are biased and which can lead me to taking compromised decisions in my life. So I personally believe that if you're going to someone who's a professional, he or she should be a good listener, understanding, and gives you unbiased opinions. So I have had friends who have been suffering from mental health issues who find it very difficult to admit it to everyone else. This it's all right, I'll manage. It's nothing, it's not something to worry of. There's this stigma attached to mental health disorders, which we need to get rid of. It's perfectly fine. Mental health is the same as physical health, just that you don't see the mental health disorder. Only the person who's facing it actually knows how difficult it is to get over it. So this is what I think counseling as such is going to help you a lot. It's going to help you a lot. It will do wonders in your life. Depression is just going to be a phase. It's not going to be part of your life.
Sir, I would like you to give your opinion on the same question.
First year. Perfect. So by the time you go to final year, you'll call depression as a disease, not a phase. That I promise. Okay. So you actually very rightly said, sometimes, so the first thing, whenever you are stressed, there are four things that can happen. One is you deal with it by yourself. That's the first defense mechanism. Like, how do I get out of it? How do I cope with it by myself? And the second is you'll reach out to your family or friends, obviously. Having a good social support system definitely works. That's the edge that people who recover quicker has. They have good social support in terms of family, friends, or, people who are dating or whatever. And the third would be going to a doctor, right? Now here there is a big question between should we go to a psychiatrist or should we go to a psychologist? And again, a lot of people don't know that, these are two completely different professions. Because, I often get referrals from a cardiologist or somebody asking me, kindly counsel the patient. So I see that, that's a small problem in terms of not understanding most of the mental health conditions. Also, before that, see, mental health conditions, we should not equate to depression and anxiety, because they're just maybe like 5% of the entire mental health conditions. For example, if you are a physician and if I'm telling you that malaria and dengue, that's all I'm talking about. What about the rest of the mental health conditions? Yes, because of the pandemic, we are more focusing on anxiety and depression. That is good. And the prevalence of these conditions was quite high. Again, when you talk about depression, it is a medical condition. Just like I'll compare it with physical health. Like, Athar said that, physical health and mental health are exactly the same, which is right. So basically health has different components, one being mental and another being physical. And then there are different aspects as well. You will read it in community medicine. There's a big definition that you'll struggle to remember. So when we're talking about mental health here, just like, let's just say, why does one have diabetes mellitus? Because there is deficiency of insulin hormone secreted from the pancreas. So there's an organ and there is a hormone that is being deficit. Imagine your body is a vehicle. It could be any car, it could be your, whatever, any car, your favorite car. Your body is your favorite car. How does it run? It runs with hormones. Just like that, how does your brain run? Your brain runs with fuel. What is the fuel for the brain? I remember this is a shortcut for all of you to write a 10 marker in your final year. First is oxygen, sugars, that's anything that you eat will be converted into simple sugars, water, and neurotransmitters. All these four are needed for the brain to work. Most idealistic and perfect way of working. So whenever you see any of these going upside down, the homeostasis of the brain is shifted. What is homeostasis? It's an equilibrium between your brain and body. And there's a gate between brain and body called as blood-brain barrier that doesn't allow anything. It's an exclusive club that only few things can get to enter into this area. So whenever, just like diabetes mellitus, there's an organ that is pancreas. Here in depression, there is an organ called brain. In diabetes, there is a deficiency of a hormone called insulin. Here, there is deficiency or depletion of a neurotransmitter called as serotonin, because brain is not run by hormones, it is run by neurotransmitters. Yes, there are some pituitary hormones also that can work in the brain. Whenever serotonin levels goes low, we should know what is the function of serotonin. Serotonin helps in maintaining your mood, energy, sex drive, appetite, concentration, attention, your confidence, energy levels, and sleep. It's a normal function of all this, just like how insulin works on carbohydrate and protein and lipid metabolism. This also has these functions. When it goes down, immediately there is a dip in all these three. Let's just say I'm somebody who has depression. Obviously, the symptoms are very simple. My mood is low, my energy levels are low, my interest levels are low. I can't concentrate well on my whatever I'm doing, be it studies or even watching a Netflix show. I can't focus on what's happening. I keep losing my track. I'll have sleep disturbances. I might not feel as hungry, or sometimes I might feel excessive hunger, and confidence goes down. And in severe cases, there'll be death wishes and suicidal intent, etc. Now, again, we divide this into mild, moderate, and severe. Mild cases, like Atal said, it's good that you just get a counseling. You might not require medicines because it's probably you're getting adjusted to a daily stressor. And not a lot of us get adjusted very smooth. For example, let's just say all three of you are put in a hostel. Maybe two of you are working well and one person is homesick and not happy with what's happening around. But see, the hostel is same for all three of you. Why is one person different? Because of how you react to the adjustment issues and your surrounding environment. So that person can go to friends and talk. And if they think they need to sort out some issues, and go to a neutral, unbiased, non-judgmental, safe space, they could go to a counselor directly, mild depression. But moderate and severe, all of you have to remember, it has to be medicines no matter what. So medicines is the main key here. Along with that, depending on the reason why the person is depressed, we could even choose counseling alongside it. But you can't just counsel. What happens when you counsel a patient who is moderate or severely depressed? they'll feel good. They'll feel better when they have a session with you. They'll keep coming back to you till they feel, you'll become a feel-good factor for them. The counselor becomes just a feel-good factor. Someday you'll run out of money or you won't have enough time to talk to a counselor. All the symptoms will come back because there is still the serotonin depletion that remains uncorrected. So compare it with physical health. If a diabetic comes to you, levels are slightly high, you will tell them lifestyle modifications. You'll tell them do exercise, don't eat, sugary food, and have a healthy lifestyle, you'll be fine. But somebody's come with little more sugar levels, you can't just give only this advice and send them back. You will have to put them on either insulin or OHS that will work with your sugar control. So when you compare it with the physical health condition, everything will make sense to you. Yeah. Did it make sense to you?
That was a great response. So moving on to the next question. How can counseling help undo the pathology in depression?
So, as Sir mentioned right now, we have a class of happy hormones, as it's called, serotonin being one of them. So, depression is caused by depletion of serotonin, right? So, there are a lot of, while going through the topics for these, I came across this information which said that there are a lot of serotonin boosters. For example, we've all seen it. If you're feeling sad or low, we just go out for a walk and our mood is uplifted. So, exercise. There are food factors like cheese. Everybody loves cheese. So there's cheese or eggs or nuts, which are serotonin boosters, meditation. So basically these lifestyle changes. So in any way, if a counselor can motivate you to incorporate these things in your lifestyle or can help you make up or follow or stick to a plan to lead a lifestyle more resembling to this one, maybe it can help reverse the pathology of depression.
Mild depression, it'll get better. Moderate and severe, you need to do both the counseling and medicines for sure. Again, going back to the comparison of diabetes, definitely. But see, if pathologically somebody is deficient of serotonin, just counseling won't bring it back to baseline. But somebody is having, let's just say, a serotonin levels are, if this is your baseline and it is just fluctuating. Let's just say, you lost your cat or you lost a friend or you had a breakup, you had some financial trauma. All these are happening at once. So whenever there is stress and serotonin levels keep going up and down, up and down, up and down, mostly down. So when this is happening over a period of time, they remain on the little below the baseline. So that minimal pathology, research says that, can get better just with counseling and how you probably look at a stressor and how you deal with the stressor. But otherwise, if it's a proper serotonin depletion, counseling research shows that counseling won't reverse the pathology. It'll definitely make you feel good. It'll definitely make you handle your life issues better. Overall, you'll feel happier. All that is there. But pathology, when you talk, not entirely. Little bit, yes. Again, like she said, but eating foods that will boost serotonin, all that will help. That will definitely help. Like we call them superfoods, right? Nuts and, all of that.
Okay, great. Thank you so much. Let's move on to the next question. This question says that if right counseling can help one bring out of the mental illness, can wrong counseling push one farther into the mental illness?
Hi, this one's me again. So I've had a personal incident with this, wherein a friend of mine was was visiting a counselor, and I was talking to her about it, and she was clearly unhappy with it. A lot of words unsuitable for this meeting were used, but basically, what she said was the counseling did not affect her, or she felt stuck in the same way, considering it was one of the best hospitals and a really experienced doctor, and so she felt all the more hopeless and helpless about it. So instead of helping her, it actually pushed her deeper into it. So recalling this incident, I do believe that inefficient counseling or not up to the mark counseling may cause some harm.
Yeah. So again, I'm not saying just because I'm a psychiatrist, but I think the first place that you should go when there's a mental health issue is a psychiatrist, not a counselor. Because what happens is there are many things that could be affecting your mental state. It could be as simple as vitamin D deficiency. In the pandemic, because people are working from home, how many people got deficient with vitamin D? A lot of them. In fact, me, who is going to hospital every day because probably my commuting time is shorter, the roads are much more clearer. My vitamin D levels have gone down really low, and I started feeling extremely low. So I thought naturally I'm feeling low because I'm seeing a lot of deaths and disability around me because of COVID. But later I just did my blood test, thyroid and vitamin D. Immediately I started taking vitamin D replacement therapy. I started feeling much better. COVID didn't change, pandemic changed nothing, but I started feeling a lot better. My energy levels are higher. I'm not feeling as sleepy in the morning. I'm active. My attention is better. My weight issues also have been reversed. I was not getting as irritable. So this, you will not know if you just go and see a counselor. In fact, it might just keep getting worse because with time, if you don't correct it, it'll keep going low. It'll go from, it's supposed to be 30 to 100 vitamin D. Mine was 22. Let's just say I was just going for counseling and it's gone down to 15 to 7 or 4. It would have caused much more major changes with my calcium metabolism and many other things because all these are interlinked. That only all of us will know as doctors. I will know a little more than you because I'm a specialist. So doctors are the right people to guide. A lot of people, what they think is, they think like, it's a choice. It's a choice that like a vegetarian food or non-vegetarian food. I'll either go to a psychiatrist or a psychologist. I'll either take medicines or I'll take counseling. It's not like that. First, see a psychiatrist, let them evaluate you and see if you need counseling. If the psychiatrist is also counseling, go for it. Or if they refer to someone who is good, confide in them and go for it. Like I personally don't counsel only because I work with a super specialty hospital and the time doesn't allow me. So I refer them to the people who does the job. Coming back to the actual core of the question, can it push you in a wrong direction? It can, and it did to a lot of people. There could be two problems here. One is, you as a client, your expectations can be something else. You might be in an abusive marriage, or, you're having a lot of financial problems and you're going to the counselor expecting all these things to get resolved by their own. They're not going to happen. The counselor is not somebody who is going to give you solutions. Your friend might give you a solution. Your friend might tell, why don't you break it off with your spouse? Or why don't you, shift the job and make more money? Counselor has never, right, from what I know, because I'm not a counselor, from what I know, they're not supposed to guide you in any direction. They're not supposed to tell you what to do. They'll just guide you with your own thoughts and just entangle them and help you see the picture. Probably you don't even know you're in an abusive relationship. You think, that's how all relationships are bound to exist. So maybe they'll help you see that you're in an abusive relationship and they'll help you. They'll ask you, in fact, what do you think will work? Because you know your spouse better than your counselor. So they'll ask you what will work for you, what kind of communication will work with your spouse. So both of you together will reach a common conclusion. So I think expectations could be one problem where, you might feel like the counseling is not going good. And the second thing could be, sometimes the issue isn't deep. The issue is very superficial. In counseling, they dig deep. It's not needed. For example, if I'm just giving an example, right? Something that I saw recently. This patient has 2 failed marriages, and now obviously she's a woman, and everybody's blaming her that it's your fault. Because one time, if my divorce happens, it could be like, okay, there's a problem in the marriage, but it's a pattern. It's happening, so maybe something is wrong with you, and she's being blamed. Obviously, she had clinical depression, and she's being treated by me. I told her, it's difficult, having a failed marriage twice. And now, even if you want to find another companion, there'll be societal judgments and your own family might be judging you. It could be very difficult for you. Why don't you also go see a counselor? And I refer to the counselor. Now, one interesting thing what came out was that, she was sexually abused in her childhood by her own father. So now, in such sensitive age, what happens is your brain don't know what's happening with you. And by the time you realize it, you love your father. At the same time, you hate him for what he's done to you and what he's taken away from you. So the same thing is happening in all her marriages as well. So she's reflecting her father figure onto his ex-husbands. So that called for a failed marriage. Now, the problem is some of us, I mean, men, women, some of us might be going through abuse, different kinds of abuse or neglect in childhood or whatever, in college life, etc. Some of us, we have our own good defense mechanisms to get over it just by, saying no and getting out of that situation and moving on with your lives. When you go to counselor, when they dig deep without depth, all these issues will surface and they'll crop up, and that will make you feel miserable. And these are wounded, these are healed wounds. You don't want to keep again rubbing them. So it can work both the ways. So in the first session itself, you should talk to the counselor and tell come to an objective. Why are you here? And what solution are you looking at? Are you just looking at understanding how to work in a marriage? Are you just understanding how to work with a colleague in a workplace? Are you just working to make better financial decisions for your own? So the answer is, again, one is expectations of the patient itself. If they expect all the life problems to get corrected with counseling, that's not going to happen, because you are the reason for your own happiness. Not counselor is not going to give you a key for your happiness. And second thing, sometimes when there is no depth, it's unnecessarily dug too much and too many issues are coming out. They call them unresolved conflicts. Sometimes they're resolved. Time will heal some things, and your friends might heal some things. You might heal some things. You don't want them to unnecessarily come up and disturb your current life situation. So come to a common objective of, what are we trying to achieve in this therapy with a counselor. And, so you'll probably, you won't have, it won't, bounce back. You won't fall flat.
Thank you so much. Moving on to the next question. So how do we break the stigma that is associated with counseling and psychiatry?
Hi, that is me again. So in a country like ours, where mental health issues are highly disregarded, it is very recently that we started speaking up about them. It can be very difficult to deal with the incorrectly associated stigma. So as long as we don't walk in the shoes, personally, I can only advise. So I think one of the, I happen to read this somewhere, that one of the things you can do is not associate yourself with your disease. So instead of saying I am bipolar, you can say I have bipolar disorder. So not making your disease your identity, or understanding that it is not who you are, it is a part of who you are, which can be cured, can be a lot more helpful. The self-doubting or self-shaming, you can say, or self putting your own self down over this, telling yourself that this is something I should have been able to handle, or there is something wrong with me, or starting seeing this as a weakness, can be detrimental, I think, because as I said, it is a medical condition and it can be cured with help. There is a solution to at least most of it, which should be considered. And there is absolutely no harm in seeking. We don't think twice about seeking medical opinions about other things, right? So maybe we start treating this as one too. And as people who are not suffering through it, we can be a little more compassionate and empathetic. We can start maybe normalizing it, not making a big deal out of it as such, and us making it a part of our lives, making it a part of their lives, because it is essential to them and us both.
Yeah, I mean, she rightly said it. I think stigma does come from more than the person who himself or herself is going through a mental health condition. I think it does come from the society around. It could be not even society. It could just be your own, your own family. That could be stigmatizing you. So it does come from there. So I see two things happening with mental health. One is it's all very hush hush behind the closed doors, and second is it's over dramatic and just sensationalism. They make it like such a big deal about it. Like, for example, if you talk about Deepika Padukone, a lot of people, she's a brand ambassador of mental health. Fantastic. She has a voice. She's using it great. But I think they make the entire the story of depression very dramatic. If somebody is talking about malaria, they won't make it so dramatic. Machhar kata hai or malaria hua hai. It's that simple. Whereas with the depression, there's so much drama around it, and uh, not necessarily, For example, like I had clinical depression. I don't have English depression, like saying like I'm depressed. I had clinical depression where a lot of things went wrong in my life at once, and I got treated. I was on medication for 1 year. So what happens is whenever I tell this to people, um, I don't know how it's taken, because I think some of them might think that this could be the story that I'm trying to sell, because I'm in the area of mental health, and it could easily give me a little more attention. That's why probably I could be telling this story. Or another person is, could be sympathizing, not empathy, sympathy. They're like, oh, that's so sad. What happened to you? That kind. I'm not comfortable with either of these. So just understand that to strike a right balance, and conversations definitely help. So why I tell that I had depression is not to tell that, look, I'm so open, I'm so great. No, that's not the reason. Why I tell is so people know that it's such a common condition, and people know that there is hope and you can get better. If me be sitting on the other side of the table as a doctor who's a specialist working with the super specialty hospital, doing fantastic for myself, and if you feel the depression is going to be end of your life, might as well kill yourself. It doesn't make sense. So you need to see someone who's gotten better. Just like COVID, initially we all are like, oh, if COVID comes, you're going to die. But as we're hearing more and more news that even 104-year-old female conquered COVID, there is a ray of hope for you. So conversations definitely help without sensationalizing them or dramatizing them. How you address things definitely help. For example, you know uh, English, we keep using these words. Whenever your mood is low, you keep saying, I'm feeling so depressed. Even I say it instead of preaching to people that you can't use this word so easy. Even I say it because that's what I grew up with. Correct. I mean, this English is what one of my strongest languages. So I say that I'm feeling so depressed or I'm feeling so anxious. So understand that both of these have different meanings. English English way of explaining your emotions is very different from medical way of explaining your emotions. So probably switching it up with I'm feeling low than saying depressed. I'm feeling nervous than saying anxious. Um, I'm a perfectionist. I like things to be very clean and in the proper order than saying that, you are so OCD. And OCD has become a very fancy thing for people, saying that, there are jokes that, you're so OCD, she's so OCD, he's so OCD. And, that becomes their identity. And some people actually enjoy it. Some people hate it, some people enjoy it. So I think these kind of little things, and you youngsters can change it because most of it comes from, not that I'm old, but most of it comes from your age group, in your college, like how you address each other and what kind of things you tell each other. I think that is one thing that needs to change. And sympathy is something that nobody would like. I would hate if somebody shows sympathy on me, because I think I'm fantastic for my own self. I don't want someone to pity over me. Well, if they want to have empathy on me, that's great. If they understand that my struggle and think that, yeah, that's a struggle, that's difficult, that must have been difficult, I think that will give me that feeling of belonging in the community that we all so crave to belong. I think mainly it's awareness, and that's what I'm trying to do my channel as well. Because um, how do you know that you have a panic attack? How do you know your heartbeat is racing? And it's a condition. Most of the people with panic attacks, they go to cardiologists. They don't come to psychiatrists. Cardiologists refer them to psychiatrists. So people don't know. It's not stigma always. It is lack of education and lack of awareness also. So that's why you need to do more campaigns and tell people this is a problem. Somebody don't know if they're addicted to alcohol or not. They think, whenever you ask an addict, right, are you addicted? Do you think you're addicted? They say that I'm not addicted. How do you know that? I can stop whenever I want. I just don't want to stop now. I can stop whenever I want. So they don't know it is addiction. In fact, how many people know that it's an addiction? Somebody who is smoking 2 cigarettes per day is also an addiction. They think they can get rid of it. It's not in their hands clearly. So I think education, awareness, and conversations, all this definitely helps.
That was very helpful, sir. Moving on to the next question. This comes to our mind quite often that if a person is put on medications for a mental illness, is it true that they have to take the medications throughout their life?
Hi, so I'll be answering this question. So whatever I read about it, I read that first of all, this is a very big myth that antidepressants, particularly, are addictive. So they are not addictive. You can get out of them once you feel better. However, there are some withdrawal symptoms, and the doctor has to taper it off. So you have to, like, you can't just immediately stop it, but you'll have to taper it. And since depression is more of an episodic process, and so it really depends on how severe it is. So a really severe case might require you to take the depressants for a longer time, but otherwise you can actually taper it off and you can stop your meds.
Yeah, Nilufer spoken like a true professional. No, you're right, Nilufer. Every line you said is something that I would tell all my patients. I think I don't have to clarify it. When you say mental health conditions, again, see, we immediately equated it with depression. Are you seeing the actual thought process? Because she asked a question, medications for mental health conditions, do they require lifelong medications? Sorry, the diseases, do they require lifelong medications? Immediately, Nilufer thought of only depression because that's how we are being so tuned. This is a problem with too much awareness also. Like I said previously, there should be a right balance because, let's just say I'm not stressed and everybody in the media is telling me that everybody is going through anxiety, like it's supposed to be such a normal thing to a pandemic. People who are not anxious also, there are people who told me that I'm not cooking this up. One patient came to me and told that I think something is wrong with me. I think my serotonin is too much. I'm not feeling anxious at all. Do we have to correct it back to the baseline? Is this person told me? I was spellbound and ecstatic at the same time with what goes on in people's brains. So there should be right balance. And so for mental health conditions, it's simple, just like physical health conditions, right? It depends on the disease. It depends on what disease you have and what grade of disease you have. If you're talking about depression, I think she already answered it. Severe depression might require you to take for over a year, but not lifelong at all. Mild to moderate depression, 3 months or 6 months or 9 months. So that's it. You won't have withdrawal symptoms if they're tapered correctly. And yes, I think Atar will answer us with the pharmacology. Definitely, there is no dependence in antidepressant category at all. Benzodiazepines have dependence, that is if it's used for over a period of time. Yeah, but something like schizophrenia, you might require a little longer time of medications. Something like bipolar, if you have more than 2 episodes, you might require longer time of medication, but not necessarily lifelong. Yeah.
Okay. So following up on the same question, I would like to ask, can the side effects of the medications be worse than the condition itself?
Okay, that's my question. So, as you all know, paracetamol. If you have paracetamol in excess or just paracetamol, it's going to have some side effects, such as rashes. You can experience a lot of different skin rashes, a lot of bad things when you take paracetamol. It's same with antidepressants. So, before your doctor actually finds one medicine which is outweighing your risks, which shows more benefits than the risk, he or she will be advising you to take different meds. Of course, a professional knows it better than what I will do. A cocktail of medicine can cause some problems. If it can cause some problems, it might have some side effects such as insomnia. You might feel agitated more often. Uh, you might lack sleep. Apart from that, you will have episodes of just feeling very low even after taking the meds. So it's not that it's going to cause a lot of problem, but yes, every medicine in this whole world is going to cause some other problem. And if it is outweighing the risk, then I think you should go ahead with it, because as Dr. rightly said, depression, or right now we're talking about depression. So depression is mild, moderate, and severe. So for mild and moderate, the dosage is going to be less. It's going to be low. So the episodes or the problems or the side effects which you face are going to be little or less. Won't be negligible, but yeah, I'll say less. But when you have severe depression, you will have higher dosage, which might cause some problems, and you will have to face it. It's for your own good. Yes.
Yeah, that's my favorite example, Atav. I keep telling about paracetamol. I think I would have bad-mouthed paracetamol quite a bit in terms of giving example to my patients. I wouldn't equate it with paracetamol, to be honest, but see, again, any drug that has the capacity to cross the blood-brain barrier and goes into brain, it can go into the unwanted areas also, and sometimes into the peripheral parts of the body also it can go, because you're not injecting them into the brain. You are taking them orally, and they will bypass, and they will go through stomach and liver and all of that, right? So they can have unwanted side effects. Here, I think more than the medicine, choosing a right professional is very, very, very important. Little more careful. I always tell people, whenever you're choosing a neurologist or a psychiatrist, be do little more research than just going to any Tom, Dick, and Harry. Why? Because someone with a good knowledge of medicines and who knows drug interactions is somebody that can definitely help you with. When I say professional, first is you have to go to psychiatrist, no other. You can't go to cardiologist and say that, just treat my anxiety disorder, and they will give you a cocktail, like Atha was mentioning. Instead of that, go to a psychiatrist. And I always tell patients have this conception that, uh, if doctor lets you speak for more time in the in your appointment, they think the doctor is fantastic, he's a great listener, right? But I believe, always see if the psychiatrist is speaking more than you, if he's asking you more questions, if he is explaining you more things that you need to understand, then you are with the right doctor. If I'm just sitting here and just nodding my head for half an hour and just writing a medicine, that's not enough. Because how do you know what are the drug interactions? Doctor has to ask you. If I'm giving you a medicine, I should ask you, do you have a thyroid condition, or do you have seizures? I need to ask these questions. A patient is not going to come and give you a beautiful history. So always choose a right professional, that is a psychiatrist, that is somebody who is good with their medicines. Fortunately, most of my patients are completely fine. Again, I'll give you a simple example. If patient is coming to you, this is mostly for the medical students, right? If the patient is coming to you saying that they have depression, and you didn't ask about the past history, you are treating it as a depression, and you're giving an antidepressant, very good antidepressant, and with least amount of side effects, and fantastic. You've taken all the negative history also. No thyroid, no seizures, nothing. You've given it. Patient will come back with mania. Why? Because patient had a past episode of hypomania or mania somewhere in the early teens, which you missed, or which patient only missed. Probably they didn't know, or sometimes they won't tell you. They're like, oh, that's just, in the past. Why should I bring it up now? It's not relevant. So they'll only talk about this, and that is bipolar disorder. That's not depression. So bipolar can occur as mania or depression. If you just give an antidepressant in a bipolar patient, they will switch into mania, and mania would be more worse and more stigmatizing than depression. Depression, at least people have empathy on you. In mania, nobody will have empathy. They'll be annoyed of you, which is not a right thing to do. But still, you caused mania. So you are supposed to take proper history as well here. So with proper history and good knowledge about medications, not just your own medications. That's why we don't just do psychiatry. You do MBBS and then do psychiatry. So you need to have a basic understanding of your pharmacology knowledge and understand, oh, this drug and that drug, they're not friends. They don't go along well. So you're not supposed to put that. So with that, I think most of my patients don't even have any side effects. I keep asking, because in my post graduation, I was taught that there are so many side effects, right? You have to be aware of them. And I'm asking my patients, they're like, I'm perfectly fine, doctor. And I was wondering, are these medicines even working? Why are my patients coming and telling there are no side effects? So I think with the right amount of treatment, I think negligible side effects like nausea, vomiting, your favorite side effects that you'd write in all the answers, that'll occur. So you'll give an antacid and ask them to eat well and then take the medicines, and just like that. Otherwise, I think you're good to go. So choose the right professional. And again, if first medicine doesn't work, what happens is patients will be like, okay, these medications are horrible. They're making me drowsy. They're making me this. It's a wrong decision that I went to psychiatrist. Now I'll go see counselor. No, please go back. If your sugars are not controlled with, a drug doctor has given, if BP is not controlled, won't you go back until it's not controlled? Won't they add another medicine? Won't they change the medicine, change the dose, or change the medicine itself? So please go back and tell that this is not working, doctor. I think this is not working. What is the next step? Immediately they'll take a second opinion with another psychiatrist, and then another psychiatrist. What often happens to me that the first doctor has given good medicines. Now I can't tell they're good medicines and send them back, because they'll never come back to me. They'll go to the third doctor. So I will change the medicine just because patient, we have to retain the patient with us. It's unfortunate. So patients also have to be a little more open, and that's why there are follow-ups. You can't just do one visit and expect things to be okay. Yeah.
One more question for you. What issues can be treated with counseling only, and what issues do specifically require medication?
That's actually my question, but I think Sir has briefed us over it. So I think he explained to us how we need to severe cases need medications and counseling alone can't treat them. So if we discuss the mild cases, I guess there are a lot of problems which can be dealt with counseling, like there is addiction. Maybe there is you've lost somebody who's like really close to you, or you're facing bullying, maybe verbal, maybe physical. You have somebody in your family who is ill for a long period of time, and that's bringing you down. There can be some relationship stress or some trauma. Besides, there is like many kinds of therapies, and different therapies subject to different things. So there is cognitive behavioral therapies, which are usually given when people don't really want to go for medication, so you try to go for that. So it actually does help for a little bit, at least for depressions and anxieties and all. And then there is behavioral therapy, dialectic one, which helps us for interpersonal problems or suffering disabilities. There is supportive therapy, which mainly helps to bring up your self-esteem. But like Sir also told us, in all severe cases we have to go for medications.
Therapy really works in terms of, let's just say I don't have any of these problems. If you've seen my bio, I've said that I'm specialized in this, that, this. In the end, I added a tail called psychological issues like interpersonal problems. So that doesn't require any medication. So if you and your boyfriend or girlfriend is coming to me saying that we both have compatibility issues, I won't give you both medicines, right? I'll refer to you a counselor, or obviously I'll counsel myself. So that's so that you'll have a smooth relationship. So that won't cause any mental health issues in the future for you. So like she said, CBT is very popular. This usually works for people's thinking styles. A lot of us have thinking pattern where we are always all or none. We see everything as like either black or white. There is no gray. It doesn't exist. That it's either I'm a wonderful doctor to you, or I'm a horrible doctor to you. You don't see that like things can go wrong with doctor as well. So I think it's just a silly example, but people who see things like that, or people who blame themselves for everything bad happening around them, or people who don't actually deal with issues, but they just brush them under the carpet and just move on. They act like nothing, nothing happens. Or people who bottle up their emotions. For people like that, counseling definitely works. There are no medications for that. But again, these things might cause depression as well. So see a doctor, and then you'll go with counseling. CBT is very simple. CBT will ask you what is your constant worry. They'll say that I feel like I had COVID and die. They'll ask you to exactly reverse it and tell me what is the other possibility that can happen. That I might get COVID and I might still survive. They'll ask you what other things can happen. Not COVID. So if you're given three options, that is 33.333% chance. So I focus on third things. What about two-thirds a solution that can occur in a pandemic? So did the counselor do anything to you? No, he only made you answer what are the other possibilities. That's how exactly therapy works. They will let you speak. They will let you understand. Said before. So grief can be normal. Grief is normal, not can be normal. Sometimes grief will turn into depression. Then medicines are required. But just grief, if you need support, you should definitely counselor. Yeah.
Okay, sir. Those were the questions from my end. Now I would like to ask the panelists if they have any questions for Dr. Charan.
Hi, sir. I had a question. So, do alternate therapies like acupuncture in any way help dealing with mental illnesses?
See, these are for textbooks, after reading the entire topic, in the end they're there because they're not medically proven. They say that they can be used as a complementary treatment alongside the main treatment, but just let alone them, absolutely no efficacy. It's just like you have an orthopedic problem, you're seeing an orthopedician, you're doing your physiotherapy, and alongside you're also doing, this whatever Ayurvedic search or acupuncture or tantric healing or whatever it is, whatever you call it. So they also are shown to have some relief, but that shouldn't be your main modality of the treatment ever.
Thank you, sir. One more question I had. Sir, how valid is that? I think, if I'm not mistaken, the name was placebo effect. Something about you having a false sense of being treated. Like if you're giving sugar tablets instead of actual tablets, and you still say, "I'm feeling relieved. I'm feeling relieved." So, does that ever happen? Like only by visiting a counselor or a psychiatrist, does that effect ever happen? And how do doctors incorporate that in their treatments? How do they know that no, this is not working, they're just saying it's working?
I think placebo is a big thing in allopathy, right? I mean, there is it's how we are wired or tuned to believe that going to a doctor, just talking to the doctor will heal you. Any doctor, not just psychiatrist, any doctor, you go and talk to the doctor, the problem will get half resolved. I think it's just your belief system, especially with mental health, because health conditions are not they're not physical, they are your thoughts and behaviors and all of this. So if you tend to believe that I'm getting better, you will feel better to an extent. Again, this applies for mild cases. Sometimes patients are so particular in asking us to give medicines because they don't want to go to counseling. They're like, no, treat my mild depression no matter what. So what we do is we just give a vitamin D or some cocktail of vitamins and tell that, this will definitely help. This will elevate your mood, which it does a little bit. But they also believe that, oh, this is doing wonders. And placebo is a thing in mild conditions.
So I have a doubt. You as a doctor, when patient comes to you with a lot of problems, like a lot of negativity around you, how do you manage to deal with it as a doctor? Does it affect your day-to-day life?
As in negativity towards me, or like the person is just...
Or just that their problems as such, if a person's facing a lot around, let's assume you have 5 patients who come up to you. So if someone's happy, they won't be coming to you. It's just that when they are sad with a lot of mental health issues, they'll be opening them to you. And how exactly does it affect your life as a doctor? Does it make you more negative as a person?
I hope not. I hope to believe I'm a happy person. So what happens, Atav, is that when we are trained, right, in a specialization, every day we are made to, when I'm looking at patient, I'm not necessarily looking at let's just say my patient. I'm not looking at Atav or somebody who looks like you. I'm just looking at, how your brain is working. You think, could thyroid be a problem? Because he's a man who is an engineer who is working from home, you think his vitamin D levels are low. So your logical part of the brain is always turned on, not necessarily your emotional part. So when patient is talking to any doctor, psychiatrist, non-psychiatrist, whatever, your logical part of the brain is what is working. So you're looking at a patient as a patient and trying to understand that where this is coming from and how best you can treat it. So mostly you don't get affected, but there are rough days where like last one was very rough for me because everybody's coming with only depression. That's all I'm seeing. I'm not seeing any other psychiatric problems. And everybody have lost someone. And not just losing, but they didn't even get a chance to tell them goodbyes. So that obviously that affected me so much that I kept hanging on to my mother. I was coming and always sitting next to her, not let go of her. It does affect you, but I think you learn to deal with it. As a doctor, I think you just take it stride and just move on, because you somewhere put your profession more than anything. You all will do that too. You'll all somehow, you just can't draw work-life balance. Unfortunate truth, but you can just never draw work-life balance. You're always sucked into it. voluntarily, involuntarily, you're constantly thinking about, oh, those patients who got admitted. Tomorrow morning, what should I do to them? Should I make any changes? Did their reports come? Your life becomes about that, and you'll enjoy it. Actually, saying it's, but some days, yeah, it's quite sickening, and you want to. That's why there are vacations and Sundays.
Okay, so I guess it's time to end the talk show now. We've had a great time, sir. Thank you so much for joining us. You have shared some really valuable experiences and information bits that we will definitely be using for us and would be helping us. Thank you so much. The panelists also, thank you so much for joining. We've had a great experience. I hope you guys also learned a lot from today.
Yeah, all of you have been wonderful. Medical students today are doing a lot. We didn't have all this. We were only studying and presenting cases. Even though, like, I passed out 5 years back, but there's a lot of shift in the generation how they look at things. I'm very proud of what you all are bringing to the table, and you three didn't really talk like for para and preclinical students. You all spoke like wise to be doctors. So good luck and stay safe.